Hi everyone, thanks so much for tuning into the Bloom Method's YouTube channel. I'm Brooke Cates, I'm the founder of the Bloom Method, and today we're gonna chat about questions. Lots of questions about pregnancy exercise, the do's and the don'ts, lots of confusion around diastasis. What are the best things for you guys to do immediately post-birth, birthing positions. I had a flood of questions come in. So I'm sitting here with 2 pages full of questions that I've printed off from Instagram. And I'm gonna do my best to answer every single one of these questions as thoroughly as possible, but not giving away too many hints because our online studio launches in May of this year, and we're gonna give you so much yummy information, education, so many wonderful workouts in that program. So if you want more info on that, feel free to pop by our website, look for updates. We'll be posting about that more and more as it draws closer. Okay, so I'm just gonna get started. Let's see. If once your diastasis recti has closed, will returning to planks and other taboo exercises cause it to worsen again? So it is pretty common for pregnant and postpartum mamas to be told to avoid planks, traditional abdominal exercises, and it's really put this fear cloud around you guys where you're terrified to go to your favorite workout class post-birth or even continue your favorite workout class during pregnancy because of all these fears surrounding traditional abdominal exercises and diastasis recti. So the quick answer is no. As this follower describes taboo exercises, I would probably lump those as pretty traditional abdominal exercises. That will not always cause your diastasis to worsen. At the Bloom Method, we try to send you guys a slightly different message than you're usually hearing. And that message is, it's not about the exercise, it's about how you're performing the exercise. And mainly, to go a little bit deeper, how you're connecting to your core during the exercise. So at the Bloom Method, we really set you guys up with progressing exercise safely so that when you are done utilizing our methodology, you actually take the foundation of the methodology and add it to every form of exercise and fitness you will do for life, because we believe that we're gonna teach you the building blocks to help you make every core specific exercise and really every full body exercise more effective than ever before you were pregnant. So if you've healed your diastasis, if you've been told that you've closed your diastasis, and you can maintain core activation from the pelvic floor up to the rib cage during the loading phase of the movement, during the work portion of the movement, if we're talking about planks, the entire time you're in a plank, you should be able to stay engaged from pelvic floor up to rib cage, because this is gonna help you regulate the intra-abdominal pressure in your abdomen, and that pressure is what's gonna weaken the connective tissue, weaken the abdominal wall, weaken the pelvic floor, thus create a bigger issue with a healed diastasis. Okay, next one. When entering your last few weeks of pregnancy, how do you self-check for diastasis? Okay, so this is a tricky one because at the Bloom Method, we have helped hundreds of women prevent separation during pregnancy from worsening, and there have even been a select few women that we have helped heal separation. Yes, I just said heal separation during pregnancy. It takes a lot of dedication, a lot of discipline, so it's not something we always guarantee, but we can provide the tools and the building blocks that will help specific individuals do that. So because we believe that diastasis can be improved during pregnancy, again, not commonly what you're told, but we see far different results with our clientele. It can be a little tricky to check for diastasis during pregnancy, especially in the way that this follower positioned her question with towards the end of pregnancy. I have a lot of mamas who start to worry about diastasis as their birth draws nearer, and the baby kind of gets in the way of giving you an accurate assessment of your diastasis. So if you think you have diastasis, you can perform the usual diastasis self-test. It's all over YouTube. I think Birth to Fit Mom, Knocked Up Fitness, some other colleagues in the same industry as me do YouTube free videos of a diastasis check. So check those out. But you're gonna get to a point where you may feel a slight bit of separation, and then you just feel baby's positioning. And that can be a little tricky because it gives you an inaccurate assessment of your actual diastasis. So I would recommend seeing a professional. If you're truly concerned about it, see a professional and let them gauge what's going on in your core instead of you having to self-diagnose your diastasis, especially becoming so close to birth. If it's gonna do nothing but cause you stress, I'd recommend just waiting. Always remember that diaphragmatic breathing, your belly pumping, so the diaphragmatic breath with intentional core activation from the pelvic floor up to the rib cage. Deep core activation holds where we start to fatigue that same inner core unit musculature. Those are all gonna be techniques and exercises that you can actually utilize up through birth. You'll even use diaphragmatic breathing, hopefully during the birth process, and then right away post-birth. So that's gonna be this more rehabilitative, gentle way to address any separation during and immediately post-birth. What main exercises should you focus on for labor? So this is a tricky one. Just because there are so many exercises that are going to help you with labor, squats are the first thing that come to mind. And at the Bloom Method, we're really geared towards shifting the way that we see exercise during pregnancy, because it's not just about the physical component. There's also this beautiful mental component that when we're thinking about preparing and training for birth, we've got to address both of them. So strengthening the mental body and the physical body, we do that a lot with our cues and the way that we keep you motivated during really challenging exercises or long bouts of exercise. But I would say squats are really, really important. It's super challenging as the belly grows to do these unassisted. So it's one of the reasons we put a bar in our studio. But having something that you can hold on gently to and do a butt to heel squat, so really dipping down deep in your squat to open up the inner thighs, open up the hip flexors, open up the hips. That can be really helpful for birth. But really what comes to mind the most for me is diaphragmatic breathing. So of course at the Bloom Method, we really push diaphragmatic breathing as the #1 foundational technique to help everyone connect with their core and create just a healthier state of being for life in each individual. But that is the breathing technique that we want you to take into birth with you. So the more that you can implement that into your daily life, the more you're going to be able to implement it into birth when you really pop into this more primal state that a lot of women feel like they can't control, they can't think rationally. So the more your body is conditioned to diaphragmatically breathe, which is going to support your birth so much better than our average form of breathing at this point in life, which is that shortened chest breath. At what point postpartum can you return to running? That's a good question. And what are the signs that your pelvic floor is ready? So if you're really concerned about the pelvic floor, which you should be, especially for my runners, my high intensity interval trainers, if you're gonna be doing any jumping, I would see a pelvic floor specialist. See an expert that can do a manual exam on you to make sure that your pelvic floor is ready. There are definitely some steps that we give our clients in preparing to rebalance and bring balanced health back to the pelvic floor, both for cesarean birthing mamas and vaginal birthing mamas. But the pelvic floor, when returning to exercise, especially those more high intensity movements, is super, super important. I always tell my clients you can definitely do some at-home testing by inserting a finger, feeling how the tissues move in relation to breath, core activation around the finger. But honestly, if you're not that familiar with the way the pelvic floor works, if you haven't worked with an expert during pregnancy or post-pregnancy, my recommendation would be just to set up an initial consult with a pelvic floor therapist in your local area. A lot of pelvic floor therapists are covered by insurance, so It's a pretty inexpensive appointment, and it will provide you with tons of valuable information. That valuable information can also be a really good baseline for you then to take to someone like myself or any of my instructors at the Bloom Method, where once we know what the evaluation looked like from the specialist, then we can kind of address it from there. Returning to running, I'm gonna tell you that actually tends to be different with every mama, honestly, but I would tell you that returning to low impact exercise before returning to running is going to be the best. So if we were to look at it as a scale of importance or a scale of safe rehabilitation exercise that is progressing you back to what you did prior to getting pregnant or even during pregnancy, I would say always, always, always begin with that diaphragmatic breath, the gentle and deep core activations, progressing to holds, then progressing to more rehabilitative based exercises that all still focus on that deep core unit. Then as you get stronger there and your uterus is no longer bleeding, you can implement those full body movements, again, trying to keep them low impact, realizing what the body has just gone through, whether you had a cesarean birth or a vaginal birth, and then progressing. So with my runners, not only is the pelvic floor health really, really important, but your core health and your connection to your core post-birth is super, super important before getting back on the trail, getting back in the gym, back in the street, wherever you are running. Super crucial that we connect to the pelvic floor and start to rehabilitate and create that foundation back in our core unit before starting to run again. It'll just make it so much easier to transition, and you'll be a stronger runner in the long run. Okay, I experienced much of my diastasis recti trauma through pushing during birth. Can you address healthy pushing? I can. Practice every single time you have a bowel movement. Use that same wrapping technique that we teach at the Bloom Method and a lot of my other pre and postnatal colleagues teach. The use and the idea of wrapping the TVA muscles from the sides of the spine all the way around the abdomen. So you're gonna utilize that activation of the core every time you have a bowel movement. The thing that shifts is the pelvic floor connection. When we activate the TVA in every other instance in life, especially in exercise, we always initiate the activation from the pelvic floor and then follow it with the wrap. When you're having a bowel movement or you're pushing baby out of the birth canal, it needs to be a little bit more controlled with that abdominal activation, but the pelvic floor must release. And for a lot of women, if we don't practice that opposition basically of core activating, pelvic floor releasing during pregnancy, it's really challenging for our minds to connect to that when we're pushing during birth. So a bowel movement is perfect to practice that. So yeah, we'll elaborate more on effective pushing during pregnancy in our app and in our online studio. But yeah, right now I would definitely tell you practice, practice, practice every time you have a bowel movement. Really teach your body how to utilize those abdominal muscles, both in a bowel movement and then in pushing during birth as well. Can you do ab workouts during your first trimester? And what is safe in regards to abdominal exercises during your second and third trimester? So that's a big question. There is a lot that is safe during the second and third trimester and really your entire pregnancy. We go through that in our classes, and we will also cover all of that in our classes on our online program. But check out our Instagram feed. We are constantly uploading videos for you guys, little mini workouts, even single exercises. Some of these will be core workouts as well. Everything we post to make it super easy for you guys will always be safe for both prenatal and postnatal. If it needs any tweaking, modifications, different forms of breathing, we will always let you know. But check our Instagram feed out and our stories out for some of those core exercises that are gonna be safe for all trimesters. The first trimester, this is an easy one. Yes, absolutely. So, you know, with the risk of miscarriage and being a woman who has lost a baby to a miscarriage, it can be really scary that we think that exercising really hard, so exercising really hard, for example, doing a really challenging HIIT workout, going for a really hard bike ride or a really long run, doing a really heavy lifting workout. This can tend to scare us, especially if we've lost a baby, because we think, oh, I'm not gonna do that again, and potentially, have another loss. Exercising during pregnancy is never the reason for your miscarriage. Know that. That is a totally different YouTube video that maybe we will do at some point. But please know and trust that your choice in exercising during pregnancy does nothing but positive things. The only time that I would say that it would bring about negative things is when you choose to exercise incorrectly, and it's going to cause core dysfunction or pelvic floor dysfunction. But other than that, baby is totally fine. Baby is healthy and happy. Your uterus is what is responsible for keeping baby super snug and safe during your pregnancy when you're doing all of these exercises and movements. So please don't worry about that. First trimester, you can basically do everything that you've been doing. What has been interesting for me in my pregnancy is that I found that it's been harder to regulate my pressure as my uterus grows. So even in the early first trimester, if you are really trying to prevent abdominal separation, watch your pressure increase. A lot of people want to know, well, what does that mean? Can you explain that? Anytime your core pushes upward and you can't keep the core activated from pelvic floor to rib cage, keeping more of a flat tummy appearance, that is going to be an indication that that pressure is increasing. Anytime you're in a prone exercise, it's gonna be harder because you have to work against the force of gravity. Leg lowering exercises, crunches, sit-ups, just watch your range of motion. Anytime that pressure increases and the belly kind of pushes forward, lessen your range of motion. See if you can control it better when that range of motion isn't so drastic. But other than that, you can continue doing exactly what you've been doing unless your doctor sees there to be other reason that you should kind of limit your movement, limit exercises. But first trimester is super easy because we can just keep doing what we've been doing for the most part. Okay, so we're gonna wrap it up. I actually still have a page and a half of questions. As you can tell, I love to talk. I love to educate you guys. I love to really make sure that you are informed. So I don't answer these questions really quickly, and I also don't apologize for it because you can fast forward through the YouTube if you don't want to hear all of my responses. But if you loved this video, we're gonna do another one. We're going to answer the rest of these questions. Make sure you like the video, subscribe to our YouTube page, because we have so many projects here at the Bloom Method that I really want to know what people want. So if you want us to do more YouTube videos, if you want me to share more about the Bloom Method, my own pregnancy, everything that the Bloom Method is about on YouTube, please subscribe, have your friends subscribe, and make sure you give a big thumbs up to this video. And if you have other questions, comment down below, ask your questions. If I have to do 3 to 4 videos, we'll just keep doing videos to make sure that you guys are getting the answers that you need. Thanks so much. It's always a pleasure to be with you guys, whether in person or virtually these days.